The development of a child after birth is always exciting. From 4 months, some children start developing teeth, a process that can be frustrating and sometimes seamless. Nice to have you on our program Your Health, showing on the Unity Station NTA Abuja Channel 5. My name is Deborah Nimi Usman, and our focus today is on teething. We will be looking at people's perception on teething, how teething can be managed, and what are the stages in a child's teething. Let's take this feature.
Teething can be a frustrating time for babies and parents. When a child is teething, the process sometimes comes with pain and other health complications.
Teething in children is usually noticed by some redness in the gum of the child, because there will be a little bit of swelling, which we call inflammation. So it appears reddish and then it's swollen, and then such a child may be a bit irritable, crying for no just cause. And of course, if the child is within the age range of teething, then we can suspect that, oh, it may be the teething process. The discomfort in the gum might also keep the child from sleeping, but it's nothing so overly bad.
Virtually all the nursing mothers will attest that teething comes with diarrhea, vomiting, and fever.
Purging, he was purging, vomiting, sick, kind of a lot of things. I experienced a lot of things on him. Some signs like those vomiting, he was weak. I was afraid, a little bit afraid, because I have not experienced it before because it's my first child. But through the help of the doctor, we went to the doctor, he prescribed some drugs for us, and with his help, he's okay and sound.
Started vomiting, then small I started purging. So I was afraid, I was shivering. I have to call the father and told him, he said his teeth. What I have to do that moment, and the body was weak. They said I should go and buy oral drip. Then I buy oral drip and mix it. I give him just like 1 hour. He regained his strength. Then small time again, the body was a bit hot. I have to give him paracetamol. The thing just continued like 3 days. Things stopped.
These claims may look genuine because of their experiences. However, medical doctors have disclaimed this assertion by the mothers that teething is responsible for high fever, diarrhea, and vomiting.
Some of them even pass watery stool, like they have frequent passage of frequent loose stools. But you even hear, like locally, some people will say the stool that the baby is passing is associated with the teeth that is coming out. But usually medically, if you look at it, because they feel irritable and then such places itches them, they want to pick anything up on the ground, anything that will actually suit their gum. Okay, and from there they pick up dirt, and then the way their system is structured is not as matured as our own, and their immune system too is not as matured as our own. So their digestive system actually reacts to that, and then that will prone to infection, and then you just see the child start passing like.
According to an online internet information, Wikipedia, in the early 19th century, in the United Kingdom, people believed teething was responsible for other diseases, even leading to death. But in the course of time, researchers have proved their assertion or belief to be false. Teething is a physiological issue that comes with the development of a child. It is neither an illness nor a disease. A child's behavior can tell when a child is teething.
I start seeing the child salivating, and then the child feels irritable sometimes as well, and then sometimes they also run, like they have fever as well. Those are what you would see like before the teeth actually come out.
And when such complications arise, What should the mother do?
There are things that actually helps them to suit their gum. We have, like, if you go to the market, you find some people with teethers, like, some of them are made in rubber form and then water, so that actually when you give it to the baby, he or she is able to it to suit our gum.
I must also warn against use of all sorts of mixtures. We hear of teething powders and so on. Most of these may contain salicylates, which is a pain reliever and an non-steroidal anti-inflammatory agent. And too much of those is detrimental to the health of the child. There was a time that children developed even kidney failure from all sorts of drugs said to be used for teething. Teething is a physiologic process, that is to say, it's a normal process in the development of a child, and usually would not need treatments. However, if the parent thinks that the child is really in pain, or the child is big enough, like 1 or 2 years, to complain of pain, such a child can be given some mild analgesia like paracetamol, and that should also not be abused.
Despite the views expressed by the mothers, teething in children can be painless and less frustrating once the mothers are able to maintain a clean environment around the children. This will in turn lead to less infection for malaria and diarrhea affecting the children.
The perception of mothers that teething is responsible for diarrhea, vomiting or high fever is not out of place, but from experiences. However, from the medical doctors, there is no relationship between teething and diarrhea, vomiting or high fever. These three illnesses are independent of teething. Next is our interview segment with Dr. John Ovoraye on teething.
What is teething?
Teething is defined as eruption of the tooth through the gum of the children. And in anything in life, when the child starts at least bringing out teeth, there might be 1 or 2 discomfort that child may feel, and they manifest in different ways. So also, parents interpret it in different forms, especially some of our rural women who are not close to where there are hospitals. They may even be forced to interpret it as if the child is dying. But teething, simply put, just as I said, is actually just the teeth of the child erupting through the gum. And this happens especially within the first 24 months. We actually say between 6 months and the 24th month. Most of them actually between 6 and 12 months. And the key point, the first teeth actually is expected at the 6th month. When a child is bringing up teeth, remember that the gum is covered with a mucosa and is soft. And just like any other human body, if anything pierces through your skin, it may bring pain depending on the surface area of that particular thing. So when the teeth are now coming out, especially the bigger teeth like the molars, the surface area is much. So as they are pushing out through the gum, before it erupts to the surface for it to be visualized in the mouth, they actually have to cause a lot of pressure. Some of them even go to the extent of forming swelling, and then some of them something that look like blood collection at the top. But that may want me to express that which are these teeth and when does these teeth actually come out. The teeth in the human body, especially for children when they are coming up, they will start with the front ones, the ones we refer to as the incisors. After the incisors have appeared, which most time is between the age of 6 months and 12 months, then the canines will follow. Don't forget that the incisors have to both the central and the lateral. After that, the canines will follow. And then the canines, after the canines, then we talk about the molars. And these molars, the first and the second one are the one that will come. The third molar, which is the one they refer to as the wisdom tooth, that one normally appear during the adolescence, about the age of 18 or so. But for these teeth that are coming up, the pains that are associated with the teeth that are erupting through the gum differ from a child to a child. When the incisors are coming out, because they have pointed edge, most time they can just pierce through the swallow gum and come out with minimal pain. And the threshold of people bearing pain actually also differ. That is why the one that causes the greatest pain is the molars, because of the wide surface area. They are not sharp, they cannot just pierce through the gum, and so as they are coming out with their wider surfaces, so also they push the tissues, creating pressure that will lead to pain and swelling and all.
What are the symptoms of teething?
1, you will find out that there will be increased drooling. The child, the saliva in the mouth of the child increases, and most time parents will say the child is always pouring saliva. The drooling actually increases as if it's running, which is different from the one that is observed before the teething starts. Beside that, some of the children, because of the swelling of the gum that they have, they will actually have pain. And when they are now having pain due to swelling of the gum, they tend to refuse food, because when you give them food or anything to eat, they support to bite, and biting actually gives them some form of discomfort. So they tend to refuse food. Others, the pain may linger on to the extent that it may affect them from having good night's sleep. So their sleeping pattern becomes poor. Some other children may present in form of fussiness, which is in form of unnecessary anxiety or easy provocation or irritability. So children that present in that form, the parents may say, why is this child all of a sudden become unnecessarily aggressive or crying too much or not cooperating or not refusing food? They may not know that actually it's because the child has just started teething. Then some of the children, because of the saliva that is coming out of the side of their mouth, constantly flowing like a flowing stream, what now happens is that rashes may end up developing at that angle of the mouth. So one may end up seeing some rashes as part of the things that we see. But these are just some of the symptoms that parents will watch out for. And when you see symptoms like this, you know that this child actually is teething. Look into the mouth, you might just be surprised to see that the child is teething. Then some of the time, you may see children who are teething also actually trying to bring their hand to the mouth all the time, trying to chew their mouth, because they have found out that whenever they put their hand in the mouth and they bite down, a little pressure actually gives them a little relief. Because of that, they constantly want to put their hands to the mouth. So when you see your child all of a sudden who is not hand sucking before doing much, all of a sudden going taking the hand to the mouth or biting, try to bite on every other thing that he or she comes across, most likely it's because of the irritation in the mouth, and is trying to make sure reduce the pressure, because it gets relief whenever he bites. So also children who are now going ahead to rub their cheek or their ear, because sometimes the pain in the gum can be referred as far to the cheek or the ear. So they tend to rub. So a good parent that observe will find out that this child is rubbing on it, thinking that the problem is the ear. The primary problem source is actually the gum that is also causing it. These are some of the things, symptoms and signs that we may notice with teething. Then we have also observed that occasionally, very, very occasionally and very, very rare, children have been born with tooth in the mouth. You will open the mouth of a new child that is born, and you find out that there is already a tooth there. Some people may think it's a taboo. Others may think that it's something that calls for maybe casting out and binding, or maybe seeking the crystal ball to know what is responsible. That child is not an abnormal child. The only thing is that that child was born with a tooth in the mouth, and that's the one that we medically refer to as natal teeth. That natal teeth occur in very, very rare. Maybe when you give birth to babies, between 2,000 to 3,000 babies, one out of these 2,000 to 3,000 will actually have what they refer to as a natal teeth. So for parents at home, if by chance a child is born with a tooth, please don't see it as if the gods have caused you. That's why the child was born with that. Just know that it's one of those abnormalities that do occur, and quickly see your doctor, especially the dentist. They will go ahead and then review the child and examine the child, because it might just be a pointer to some other abnormalities or a part of a syndrome that exists in the body.
What can a parent do when their child is teething?
I always advise parents that the whole hallmark of the whole thing is observation. Know your baby, watch after your baby, take care of your baby. By doing that, you will know what the baby is doing that is new. And by those new things that I've just listed before, that will take you to the point of at least trying to seek help. But the primary thing that you should do is that don't do too much. First, you can go ahead. Some babies enjoy when maybe you just at home remedy, try to maybe apply a finger and compress. Others may get relief from the area of probably a little cold ice applied, just like any other thing. But people may not know the degree or the extent to which they should leave it there, because it can equally cause abrasion if you are using ice in the mouth of a baby for a long time. So we don't preach it. If you notice that your baby is actually coming out with one kind of feverish feeling or one kind of pain or unnecessary crying, then you must go ahead and see the doctor, who will just relieve the pain by mere giving paracetamol or maybe any other analgesic. But we don't want things that are very strong, like the aspirin related things. But at home remedy, parents can actually just admit something like paracetamol, but it's most important thing, see the doctor.
What is the relationship between teething and malaria?
Teething is not the same thing as malaria, but the truth is that teething actually have a feature of something like fever, and that fever of teething is different from the fever of malaria or infection, because there are many things that can cause fever. So when a child have fever and the fever is just up to maybe less than 38 degrees centigrade, in Fahrenheit we refer to it as 102 degrees Fahrenheit, less than that kind of feverish feeling, and you look at the mouth and you see all the other features that I've listed before being there, such as the hand going to the mouth all the time, the child refusing food and all that, and the major thing that's enough for you to almost say the child is having teething as you're observing. So you don't need to load that child with a lot of anti-malaria. Your child may be having cough, your child may be having cold, all those things, or even respiratory tract infection. They can also present with this. Viral infections also can also present with this pool of symptoms that we look. But one thing we must take home is that teething of a child does not mean the child having malaria. Neither does it mean the child is having upper respiratory tract infection or any respiratory tract infection or even cold. So we should watch out for this. That is why we need to differentiate, because the management is so easy that the child will just overcome it, because it's part of a normal developmental process that most people actually go through. If I'm to say things more, the child brings out the milk teeth or the temporary teeth. This temporary teeth that the child brings out by the about 20, and these things that are about 20, at a certain time of the child's life, they start to degenerate. By around the age of 12 years and above, the roots of those ones start to degenerate, and when they start degenerating, then there will be replacement with the permanent teeth. The wisdom teeth is the one that we say always come out very late. And permanent teeth, let me make it clear that when the child is growing permanent teeth, there is no teething symptoms and signs. It's always very clear, except when the child is having the wisdom tooth. That's the only one that even most of us have that experience that we say, you see a swollen, you touch it, the child person cannot bite at adolescence, and at the end of the day, say, that wisdom tooth, it is true. That won't come with pain, but the other permanent teeth eruption will not come with pain. But if a child is having that abnormal, a child is born with a tooth that I said is natal tooth, which is abnormal, please, the best thing is that let the child see the doctor, and then the dentist will always try to remove it, because that tooth is always very loose. And because it's loose, what follows is that if you take the child home without removing it, it can on its own just come off in the child's mouth. And when it comes off in the child's mouth, the child has a tendency to swallow it. It may enter the airway and then choke the child. We don't want that. So when you have any baby around you, or you heard of any baby born with a tooth in the mouth, it is good to see the dentist so that that is removed. I think these are the few points that I would like to put down in the area of teething and fever.
Can teething lead to an infection?
Teething doesn't have anything to do with infection. They are two separate things. But it is not impossible, it's not out of place for a child to be teething, and at the same time for that child to have a co-infection, such as maybe the child having malaria, or the child having respiratory tract infection, or the child having any viral systemic illness. So when a child is teething and the temperature is, some of the things that we use as health workers is that a child is teething and all of a sudden the thing is not abating, it's not improving. The common things like paracetamol have been applied and it's not relieving, and so also the temperature of the child is rising. Maybe when you come to the hospital, that can be checked above 38 degrees centigrade. Then that may not likely be ordinary teething. Therefore, it will warrant the child being taken to the hospital so that all that things that could cause systemic infections, other things that could cause systemic viral illness symptoms can be excluded. And even malaria may just be there coexisting with the teething. So also infections of the chest may be there coexisting with the teething. And then even other conditions, cough, cold, they may not be there coexisting with the teething. So teething is not the same as malaria, and medically it have not been established. Therefore, parents should know that when their child is teething, they don't necessarily have to. They should not be too apprehensive. That's what I will say. Don't be thinking that maybe the worst has happened and then they will do everything, but at least seek help in the right quarter, which is from health workers who will be able to advise you and counsel you depending on what it is.
How long does teething last?
Normally, it's not something that should run for too long. We said the other time that the teeth, they erupt at different stages. The first one that will come out is actually, but most of the teeth actually should come out between the 6th month and the 24th month. Most of these features are within eruption of teeth within this 6th month and the 24th month. So, depending on when it comes out, because we've also had incidents of children who started teething at 4 months. And then we also have incidents of children who teeth very late, later than 24 months. So in everything there's going to be a majority of children with teeth between 6 and 24 months. So depending on the child's ability to also bear pain. In short, it's also possible depending on the family history of that particular child. Because in some families, they teeth very early. And in some, average and other late teethers. So a child where its family normally have people that teeth very late, the teeth don't normally come out early. Those ones are late teethers. The ones that come very early are early teethers. So all those ones have to also taken into consideration. But when a child is actually erupting, it should be, the symptoms actually comes between maybe, some people say 8 days preceding the eruption, but most books will say 4 days preceding the eruption. And it does not last more than 2-3 days after the eruption. So the symptom, I will not say 4 days to, meaning 4 days, and then 3 days after it has erupted, the symptoms should subside. Within that, it shouldn't be more than 1 week, most of the children.
Hope you have been educated on this topic, teething. Remember, teething is not a disease or illness, and it has no relationship with diarrhea, vomiting, or high fever. If your child is teething and has any of these symptoms, take the child to the hospital or any health facilities. Until we come your way again, same station next week and the same time, remember your health is in your hands, so let's stay healthy.